Okay, I'll go there.
Giờ thầy sẽ ra chúng ta có một cái mới rồi.
So take a look at it in a case like this.
Xem một cái ca như thế này đây.
So far we were talking only about intrusion arches, cantilevers, beta titanium wires. But this day and age, you gotta be using tags also. So how many of you use tags
Có bao nhiêu
in this
dùng
room?
lát giờ tay đây các anh dùng biết giờ.
How many?
Giờ hay dùng giờ tay.
Raise hands higher.
Giờ tay cao đây, thầy nói giờ tay là.
Not many of you, okay?
Đúng không?
So, if you're not using tags,
Nếu các bạn không
please learn. It's very easy because you can do some wonderful things.
chúng ta có thể làm.
So in this patient,
Là rất là dễ dàng.
we have put in infrazygomatic tag only on one side. And what we are going to do is we are going to retract the canine and put the molar into class 1 position before we change the midline. Don't work with the midline because there is no space to change. You have to create space distal to the lateral. So go to the molar, make it into class 1, canine, create a space, and then you can start shifting the midline. So this becomes very important. So we have infrazygomatic tag there, infrazygomatic tag there, and we are basically changing the midline in this way. Now, how do you intrude? I don't like to intrude with tags at all. So just I put this example there. So, for example, there are two tags going on to intrude the nose. I can do much easier because we tried this thing, and I always show this to tell that the intrusion wire or cantilever can do a much better job than putting a tag to intrude. If you are using aligners, it's a different story because aligners usually do not effectively intrude the teeth. They do not effectively intrude the teeth because it's very difficult to control the long axis of the teeth. Now we have seating elastics going on, we have space distal to the laterals, and we can finish the patient very, very nicely. Whenever you finish the patient, you never want to finish the patient like this. Okay, when I give my lectures on finishing, in one of our books, Dr. Rene and I wrote a whole chapter on finishing. The mesiodistal cusp has to be down, that means the roots are distally inclined. If this is high like this, it's not a good thing. So how do you learn from your own patients? You got to take pictures before, during, and after. And then you look at them, and then you say, oh, next time I'm going to do something better. And I do better. So that you can see the tags have been used very effectively in this patient to fix the midline without too much of a problem. Okay? Let's move faster. Come on. So now just show, oh sorry, just wanted to show you before and you can see after. The another thing with tags is going to be that most of the treatment you can finish in patients about anywhere from 14 to 16 months, even faster, if you know how to take control of everything. Arch form, upper and lower. We don't like to use braided wires in the lower 3 to 3 because these braided wires have the tendency to unwind and you can have the canine go forward. The lingual root is going to become prominent and you're going to have a lot of problems. So we like to use these days wires which are on a spool. So when you are putting 3 to 3, you are bonding and there's no tension between them. none whatsoever.
nó không có cái sự căng ở trong
I was lazy
tôi lười biếng
at one time, and I would just cut the wire
tôi cắt cái dây
and just put it there,
và đặt cái đó
and then patient would show up
và
with a
cho
lot of
đến nó
problems.
có rất là nhiều vấn đề.
So you don't want to do
Và
that.
đừng có tạo ra cái lực trong cái dây
In your patients.
cái dây chuyền đó. Như vậy
Again,
lần nữa
long axes of the teeth
cái dây của các răng
have to be pretty parallel.
nó phải
And one of the things I always teach is don't take panoramic film at the end of the treatment. Take panoramic film 3 to 4 months before you think you are done. Because now you can put the brackets again, you can change, look at the axial inclinations, you can finish the patient nicely. At the end of the treatment, you've already taken everything
cho
out.
nên
So it becomes just like a history.
cho
You
nên chúng ta
can't
phải
use it for
chụp
treatment.
nó trước 3-4 tháng.
Everybody got it?
Đừng có
Say yes.
yes thì nếu hiểu là nói yes
Don't take panoramic film at the end. Take 3 months
thì
before.
xong á, rồi mới chụp hình
Or
lại.
before you
Chụp
take
3
the
tháng trước đó để
brackets
cái đó
off.
để mình mới làm.
So you can do some finishing, good finishing in these patients. So, it becomes very important, using infrazymatic, zygomatic. It takes about 1 minute and 34 seconds actually putting the screw in. Takes another 4-5 minutes to infiltrate with local anesthetic. And you can start applying the force right away after that without any problem. I worked with Dr. Marshall Almeida. He's been coming to me at UConn since 2010. Excellent papers. We've written many papers together with him. Take a look at this case. Talking about midlines. Take a look at this midline. Completely off. Molar mesially inclined, little bit of crossbite. On that side you can see full cusp class 2. Midlines of 3.5 millimeters. And if you look at the molar, it's about 5 millimeters, I think. Oh, I think it's 5, not 7. 5 millimeters. Okay? Class 2. We want to do this midline correction and the molar correction, non-extraction. Okay? So there's our patient. So when you look at this arch form, you say, oh, this looks very nice. But in orthodontics, you have to look at it, like a plane, You can go like this, you can go like this. So yi, yaw, how the movements are taking place. So arch form looks good, but basically the whole arch is like this. You have to correct it like that. So if you take a mid-palatal raphe, you can see how it is off. You can see where it is and how would you like to correct it. And this is where you are going to see on one side the molar is class 1, on the other side the molar is class 2. So treatment planning. We are going to do unilateral displacement in this patient. 9 means is the 9th month. And the protocol we are using in this one is copper night eye. We are going to start with 14/25 and sequentially we are going to go to higher numbers. So what we are going to do here is, we are going to place infrazygomatic tag. So let's take a look at it. So we have already infiltrated with local anesthetic. I just want to show you one, okay? And now what we're doing is, we make a scribe mark in the bone, in the zygomatic bone. Now you're going to take your screw. So it takes about 5 minutes before infiltration, etc. has taken place. And now you're going to take it, and with the hand you're going to basically turn. This is actual movie, just to show you how long it is going to take. 1 minute and 34 seconds. You don't need too much force. And then you are going to basically shake it gently and pull it out. That's it. So different companies have different systems. Done. Finished. You don't need a special class. You can see 3 times this video, you can do it. Okay? Now, one of the things is when we put these screws, they are a little bit to the buckle. So you have to be very careful that your arches don't go like this. So a lot of times you would use a parallel arch or whatever it is, but you want to maintain your buckle width in these patients. So take a look at it. So now, one of the books we did was on tags. Actually, there are 2 editions of that book too. We always talk about the line of force in relationship to the center of resistance of the upper teeth, So now in this case, what we are going to do is, we have a very heavy wire going on in the upper arch, because we would like to move all these teeth as one unit. And now you can see on this side, we are using a hook, and the height of the hook is going to be changed during the treatment. Because the movement, the motion of these teeth is going to be different as you go along.